Is on association between low vitamin D serum levels and axial length causing myopia in school children. It's not. Introduction. WHO estimation in 2010, Vision 2020, Global Initiative for the Elimination of Avoidable Blindness 2020. Commonest factor among the visually impaired persons is refractive errors after the cataract. It's not.
1 minute, the time has not started. It's not moved.
The slides aren't moving, ma'am. No, ma'am. Population based studies, 30% of the world is currently myopic. By 2050, almost 50% will be myopic. That is staggering 5 billion people. In India, myopia prevalence is 40 to 30%. Myopia can be corrected, but etiological evaluation to adopt preventive measures is urgent from a public health perspective. The etiological factors are many, but one of those from the recent studies is low vitamin D levels. Although India is in tropical zone and despite of abundance of vitamin D, 75% of the Indian population are suffering from vitamin D deficiency. Although the mechanism of reduced myopia risk isn't known, one possible explanation is vitamin D is known to influence dopamine metabolism. Hence, it is a possibility that increased vitamin D serum levels increase dopamine secretion, which is known to influence the axial length, change via effect on gap junctions and receptive fields, and limit the growth of eyeball beyond its limits. The major contribution is from the sunlight for the vitamin D. Aims and objectives to know and evaluate the association between serum vitamin D levels and axial length leading to myopia in 6 to 8 year school-going children. Time spent outdoors, indoors, and BMI is taken into consideration. Materials and methods. It's a cross-sectional study with 100 children. Study period August 23. Inclusion criteria 6 to 8 years old from nearby schools of Kandakuru area hospital. Exclusion criteria those with anterior and posterior chamber abnormalities and other types of myopia are excluded. Take it informed consent from the parents. Methodology: visual acuity, detailed history and ocular examination, axial length, cycloplegic refraction, myopia of all grade is taken into consideration. Blood samples for vitamin D levels and BMI or calculator. Questionnaire from the mothers is taken for the time spent outdoors and indoors for 0 to 5 hours. Results: a total of 100 school children were taken for ocular examination for myopia and laboratory testing for serum vitamin D. Girls had smaller axial length and boys that shows no result for the myopia occurrence, no sex predilection. The answers was taken from mothers. Children who stayed longer hours indoors watching mobile and TV had higher BMI. Myopia incidence is also more in them. Out of 100 kids, 49% are girls, 51% are boys. Of this, 20 of 49 girls counting 41% are myopic and 22 of 51 boys counting to 43.1% are myopic, showing no sex preponderance. In both genders, the axial length showed an inverse linear association with the level of serum vitamin D. That's a mean axial length is in the inverse relationship with the vitamin D levels. This is the time spent outdoors and the BMI for the myopes and non-myopes. Here the time spent indoors is same equal for the myopes and the non-myopes. In non-myopes, the increased axial length is seen in few members, like 12 members, and more of the myopes have the increased axial length. This is in relation to the vitamin D levels. Of them, 10 are deficiency deficient of vitamin D, and 13 are having optimal levels in myopes, and 7 are having deficiency, and 26 are having optimal D levels. The odds of children being myopia with low vitamin D is 0.58, while being non-myopic is 0.41. The odds of children being myopic with optimal levels of vitamin D is 0.3, while being non-myopic is 0.66. Discussion: the young children, the axial length is inversely proportional to the vitamin D levels. 5 of 13 myopes have optimal vitamin D levels. Longer axial length is consistent with the answers given by the mothers. 4 of 26 non-myopes with optimal D levels have axial length, which is inconsistent with the study. In my study, only 12% of non-myopes have vitamin D deficient. half of the non-myopes are having optimal levels. A study on a Korean population who have a high prevalence of hypovitaminosis D like India showed a high risk of myopia. A meta-analysis by Tang and et al. Showed that lower vitamin D concentrations were associated with a high risk of myopia. However, they also inferred that the risk was more measurable in adults, was not significant in children. Our study have gender equal sex distribution as that of J. epidemiol, who concluded that there is no gender preponderance in vitamin D, causing myopia and odds ratio 0.65, similar to our study. Jones, Jordan et al. Prospective study, sports and outdoor activities were decreased in myopia subject 3 years before onset, thus pointing to a causal relationship between outdoor and myopia development. Strength is that myopes and non-myopes spend more or less time indoors. One drawback is sample size. Engage of the study population is a strength as well as drawback. Conclusion. It's an inversely proportional, and the suggestions are we need to encourage the children to be on the outdoors for more time with encouraging yoga and Surya Namaskarams outside with the direct sun exposure. These are my references. Thank you.